Hi, my name is Kian Hijawi and I'll be talking about Parkinson's disease with a specific focus on the new drug Xadago, which is providing hope for sufferers of this debilitating disorder. Over the duration of this presentation, at least one Australian will be diagnosed with Parkinson's disease, a debilitating long-term degenerative motor disorder of the central nervous system characterised by dysfunctional cognitive and motor functioning. By the end of the day, this single Australian will not be alone, but will be accompanied by at least another 29 individuals who will now struggle with the onset of this debilitating disorder. Further, with a 17% incline in the number of people diagnosed with Parkinson's disease over the last 6 years, it has become increasingly necessary to find more effective methods of treatment and control. To understand Parkinson's disease, we must first address the normal physiology of the basal ganglia, located in the nuclei of the brain, which is here. The substantia nigra is the main effector in this basal ganglia, with a particularly pervasive role as an effector of voluntary movement and, to a smaller extent, cognitive function. The substantia nigra regulates the action selection performed by the basal ganglia through the release of dopamine by dopaminergic neurons. When a cortical signal is sent to the basal ganglia, the substantia nigra dopaminergic neurons have dopamine released, and high concentrations of dopamine promote specific muscles by activating the cortex. At the same time, the basal ganglia has a reciprocal inhibition via suppression of the cortex of the subsequent muscle groups. When an action is not being performed, low levels of dopamine have an inhibitory effect. So, what is the physiological dysfunction associated with Parkinson's disease? Well, Parkinson's disease is a chronic degenerative disease affecting the basal ganglia, which causes the degeneration of dopamine by dopaminergic neurons in the substantia nigra. Since Parkinson's disease is idiopathic, the cause of it is not definitive. However, cases have been attributed to environmental and genetic factors, which cause oxidative stress and genetic mutations linked to mitochondrial neuronal dysfunction. Despite this lack of understanding of the cause of Parkinson's disease, it is known that the basal ganglia pathway excites and inhibits the transmission of motor and cognitive programs, and thus the loss of these dopaminergic neurons results in a severe overall reduction in motor output. Therefore, Parkinson's disease is characterized by bradykinesia, which is the slowness and rigidity of movement due to excessive muscle tone and contraction, postural instability, as indicated here, and that leads to impaired balance, and the most commonly identified sign, which is resting tremors. Naturally, you must now be asking yourselves, is this debilitating disease curable? And if not, how is it treated? Well, unfortunately, Parkinson's disease is not curable. However, depending on the stage of the disease, multidisciplinary management can be administered, such as medications and surgeries. There's been a recent resurgence in the number of people who have had surgeries with advanced Parkinson's disease, where drug therapy is no longer sufficient. Surgery targets deep brain stimulation of the globus pallidus, or the subthalamic nucleus, for the release of dopamine. Pharmacologically, levodopa is converted into dopamine by dopa decarboxylase. However, the dopamine itself cannot be administered intrinsically because it is metabolized so quickly that it would become rendered ineffective. Further, levodopa must be taken with carbidopa to ensure that dopa decarboxylase does not prematurely convert this levodopa into dopamine. Cabergoline is a dopamine agonist and can also be administered. It has a high affinity for D2 receptors, which provide constant dopaminergic stimulation. Recently, the US FDA announced the approval of a new and innovative drug called Xadago. This is a sulfonamide to be used alongside the levodopa-carbidopa combination. Monoamine oxidase B, as indicated here, is found in the mitochondrial wall, and it is a prominent dopamine metabolizer. Xadago functions to inhibit this monoamine B, acting within the brain to reduce the metabolism of dopamine and thereby increase dopamine levels and alleviate the symptoms of Parkinson's. The efficacy of this Xadago drug has been supported by the clinical trial of 645 participants who were also taking levodopa, but were experiencing an off time or a decrease on time, as indicated here. And those taking Xadago experienced increased periods of on time, as you can see here, which is a good response to medication and few symptoms without the affliction of dyskinesia. However, it is important to note that Xadago, despite its medical advancement, still has adverse reactions observed in patients which had falls, nausea, and insomnia, as well as serious but less common risks such as hypertension and episodes of psychosis. It is hoped that Xadago will soon be available for use in Australia. As this presentation culminates and another individual is diagnosed with Parkinson's disease, it becomes a relative matter, as we recognise that at least another 80,000 Australians are suffering from this disease. With a conscientious scientific effort, it is hoped that Parkinson's disease can be better treated to provide those afflicted with a better quality of life, or better yet, a cure.